Hello everyone, welcome back to my YouTube channel. I am Dr. Mayur Kardile, Director of Pune Spine Institute and Consultant Spine Surgeon at Jahangir Hospital. Today we are going to talk about Oblique Lumbar Interbody Fusion, or commonly known as Olif. Let's talk about what exactly this procedure means, what are the spine related conditions that we can treat with Olif, what are the advantages of this condition, and who exactly are the patients who would benefit out of this, and what to expect after the surgery. So let's dive into what is Olif. So what exactly is Olif? Before I give away this information, for regular spine health related updates, please subscribe to my channel and don't forget to click the bell icon. Olif is a type of a minimally invasive spine surgery, wherein for patients who need lumbar fusion, the surgery is done through a small incision right here into the flank. And from there, we get a natural plane through which we reach the lumbar spine or the lower back and land up onto the disc. And from there, exactly, the surgery is performed. And believe me, while we do all this, not even a single vital structure is cut, and we can reach down to the spine very easily. So, what are the conditions treated with Olif? Typically, Olif is a type of a lumbar fusion surgery, and it is advised for anyone who needs a lumbar fusion. And typically, those conditions are spondylolisthesis, lumbar instability, spinal deformity, or some kind of a foraminal stenosis wherein you need to stabilize the spine. Olif is also done as a part of a lumbar deformity correction surgery or adult degenerative scoliosis deformity correction surgery. At times, Olif is also a surgery of choice for chronic discogenic back pain. So, how is Olif performed? So, basically, once you sign up for the Olif procedure, your surgeon would advise you to do various blood tests, MRIs, X-rays, and once you're clear up for the surgery, you'd be getting admitted to the hospital typically one day before the surgery. Early in the morning, when the surgery is scheduled, you'll be taken into the operation theatre, and the surgery is performed under general anesthesia. We position the patient in lateral position with one side up, typically the left side up. We clean up the skin, we sanitize it, and drape out the surgical area. And once everything is done with the help of X-ray imaging or intraoperative C-arm guidance, we locate the exact disc space where we need to operate it, and then take a small incision onto the flank. From there, we develop a natural retroperitoneal plane and then reach out to the exactly to the affected disc. And once the disc is exposed, we can easily do a discectomy, do a end plate preparation, put in a Olif cage with along with bone graft. Now that bone graft typically either is allograft, or which means it comes from your own bone tissue, or it could be a cadaveric graft. This kind of a discussion will be done between your surgeon and the patient before the surgery. Now, once the Olif cage is put in, now we remove the retractors and all the structures fall into place, and what remains is just to suture out the fascia and the skin, and yes, the surgery is done. Now, as a part of this procedure, we also need to put in percutaneous pedicle screws to provide additional stability. And once this is done, a waterproof dressing is done and the patient is taken out of the operation theatre. Within an hour or so, the patient can reach back to his room and relax over there. Now, typically the post-operative pain levels after the Olif surgery are very minimal. We can expect the patient to sit up and stand around on the same evening. Our physical therapist and team of doctors will help you to do that and gain more confidence after this procedure. The next morning, you'll feel much more comfortable and you'll be walking around into your room, and within a day or two, you can expect to go back home. Once home, you'll be able to do your all daily activities with some help, and as time passes by, within a week or so, or maybe within 2 or 3 weeks, you will feel completely back to your game. Typically, the doctor visit is after 5 days to do a wound checkup, and then after 8 days to do a final wound checkup. Once that is done, the visits are spaced at about 6 to 8 weeks interval for over a year. So, what are the advantages of Olif? Now, the biggest advantage is being minimally invasive. There's extremely little collateral trauma that we do during the surgery. It's a very targeted, focused surgery wherein we reach the disc space and do the fusion. So, post-operative recovery is very fast, intraoperative blood loss is very low, and we can put in a wide cage so which fixes up the entire surface area of the end plate, and we get a reliable wide fusion. We can even put in lordotic cages to restore the natural alignment of the spine. And with this surgery, we do not touch even a single blood vessel, nor do we touch even a nerve. So all the gamut of post-operative neurodeficits, the possibility of having a nerve injury related to this surgery are extremely minuscule. Intraoperative blood loss is very low, so the recovery is fast, and the patient can expect to get back to his normal natural activities very soon. So in conclusion, we've learned about what exactly is Olif, who are the patients who would need this surgery or would benefit out of this surgery, how exactly Olif is done, and what to expect in the post-operative period. So if you found out this video to be helpful, or if you think you, your family or your friends, anyone out of these would benefit out of this video, please feel free to share this video with them. And for regular spine health related updates, do not forget to subscribe to our channel and click on to the bell icon. And if you have any questions related to Olif or regarding spine health in general, please you can write down into this comment box and we'll try to get back to you as soon as possible.